Hello, my dear students. I'm Dr. Vaishaly Bharambe. I've been teaching anatomy for the last 25 years and believe me, I love it. What are we going to learn today? We're going to learn the posterior triangle. Okay, now that's a huge topic. So I've divided it into three 20-minute lectures. The first one will cover posterior triangle, boundaries and contents. The second one will be about the muscles sternocleidomastoid and trapezius and maybe a few other muscles. And finally, the last one will be about details of the contents. So let's begin today's class, which is posterior triangle, boundaries and contents. Let's try and solve an MCQ before we do that to give you an idea of what our situation usually is as students, okay? So here you are seeing an MCQ. The following structure lies between the investing layer of deep cervical fascia and prevertebral fascia in the posterior triangle. The options are spinal accessory nerve, splenius capitis muscle, brachial plexus and subclavian artery. As you can see, it's quite a simple MCQ. Many of you probably know the answer. Some of you are kind of having a general idea, but many of you, despite the general idea, do not know the exact answer enough to be able to tick mark on the correct option. And it's because of such MCQs that we need to really know our subject well to be able to solve these MCQs. We're going to get this MCQ right back at the end of the class and see if we can confidently tick mark the correct answer. Okay, so let's begin. Posterior triangle. This is how I'm going to cover it. One request to all my dear students. Whenever you're attending my lectures, I request all of you to keep your color pencils and maybe a couple of drawing sheets ready with you, or any electronic digital drawing implement will also do. But the request is, every time I draw, kindly draw with me. You'll be surprised at how beautifully you carry much of the lecture back with you. Okay, let's begin then. First question, where is the posterior triangle? Okay, that's a good question, isn't it? Because you already have a sample of the posterior triangle in you. Where is it? Palpate on yourself to understand. Use this image on the screen to see, to correlate as we do the little bit of an exercise, okay? Right. So, bend your head to the right side. Turn your face to the opposite side. Can you see a beautiful sternocleidomastoid becoming prominent? Yes, that is the anterior boundary of posterior triangle. Okay. Now lift up your shoulders. Shrug. Okay. As you shrug, you can feel a muscle becoming prominent here. Okay. This muscle is your trapezius, which forms the posterior boundary of posterior triangle. Now I want you to lift up your shoulders. You will feel two bones becoming prominent here. Can you feel them? Yes? Yes, that's the clavicle. Obviously, that's the beauty bone. So many times your beautiful clavicle makes you. People say, nothing makes you but good character. Believe me. Anyway, that's besides the point. So, we've got the boundaries of posterior triangle. Anteriorly bound by the sternocleidomastoid, posteriorly bound by the trapezius, and inferiorly bound by the clavicle. Okay? So, having the boundaries in place now, let's take it forward from there by doing one basic diagram. I want you to draw this well because we're using the same diagram later to draw the floor as well. Okay? So, are you ready? Can we begin the diagram, please? Come on. Get your drawing books out. Whatever else you want to use, and let's begin. Right. So, let's begin the diagram by drawing a little bit of the scalp and the surrounding structures, okay? So, here is your scalp. Here is your ear. In front of it is your mandible, okay? In front of, just below your mandible, let's start drawing the neck. A beautiful neck, okay? The lower end of which is your sternum, your clavicle, okay? And just complete the line of the scalp into the neck and back. And there is your human being, okay? Now, from the area behind your ear, that is the mastoid process, begin drawing your sternocleidomastoid muscle. Which boundary? Anterior boundary. So take it down across the neck to the sternum. Take a line up from the clavicle upwards to your superior nuchal line. That is your nice and thick sternocleidomastoid. Draw a little triangle here indicating the sternal and the clavicular heads of sternocleidomastoid. From the superior nuchal line, take a line downwards to your clavicle at the junction of medial 2/3 and lateral 1/3 of clavicle. And here you have your posterior triangle, anteriorly bound by the sternocleidomastoid, posteriorly bound by the trapezius, and inferiorly bound by the middle 1/3 of clavicle. I hope all of you have been able to draw this well. Yes? Keep the drawing away. We're going to use it again later. Okay? Let's go back to our PowerPoint and take it forward from there. Right. So, what have we learned? We've learned where is the posterior triangle in our body. So, here is my posterior triangle. Where is yours? Okay. We've also learned the boundaries. Anteriorly sternocleidomastoid, posteriorly trapezius, inferiorly middle 1/3 of clavicle. We also surprisingly learned how to make these muscles prominent. You remember, turn your head, bend your head to the same side, turn your head to the opposite side, you can see your sternocleidomastoid. Shrug your shoulders, you can feel your trapezius. So we're learning so much out of these small, simple actions. Any action also has a memory. Do these actions to memorize, to recall. Okay, and then finally we go on to the apex and the base of the triangle. The apex is formed by the point where the sternocleidomastoid and the trapezius overlap each other at the superior nuchal line. The base is formed by the same middle 1/3 of clavicle. So boundaries done, apex base done. We are creating a triangular box, students. It has the boundaries of the box are done. Let's cover it with a roof and let's floor it with the floor. Okay, so the roof. The roof consists of skin, superficial fascia and deep fascia. Let's pretend that you're looking at a cadaver. Okay, you've taken an incision in the cadaver. You've reflected off the skin. Okay, so the skin has come and the skin has gone. Now we come to superficial fascia and what it contains. So as you can see, there's a whole list of structures it contains. Much easier to see than to read all these things. So let's begin. In the superficial fascia, we find a distribution of less or more fat. 1. I also find a muscle called platysma. Is it okay for us to find muscle in the superficial fascia? Yes, it is okay, but only in the neck and head-neck region and maybe in a few other areas. Because otherwise, normally we don't have muscle in superficial fascia. This is an example of panniculus carnosus. Very nice. Now we go to a lot of cutaneous nerves. All those nerves responsible for the beautiful sensations around your neck, isn't it? So, the first nerve goes towards your occipital region. Please use your hands with me. The nerve that goes towards your occipital region, called as the lesser occipital. The nerve that goes towards your ear and angle of mandible, called as the greater auricular. The nerve that transversely crosses your sternocleidomastoid to supply the anterior region of the neck, transverse cervical. And the nerve that goes towards your clavicle. There are 3 nerves actually. One nerve dividing into 3, supraclavicular. So let's do this once more and see if you remember. Towards the occipit, lesser occipital. Towards the ear and angle of mandible, greater auricular. Across the sternocleidomastoid to the front of the neck, transverse cervical. And towards the clavicle, supraclavicular nerves. Okay, this is how we remember. Use actions to trigger recall in your brain. We now go to a lot of venous network. Can you see how much venous network there is? Definitely we're not going to study it now. But I want you to concentrate only on one vein, the external jugular vein. This is a vein that is formed just below your parotid, travels across your sternocleidomastoid and then becomes a part of the roof of the posterior triangle. As you can see in the lower part, it pierces the deep cervical fascia to finally drain into the subclavian vein. So what are the two things you're going to remember? External jugular vein pierces deep fascia to drain into subclavian vein. Just remember these two things. Okay. We also find a lot of cutaneous arteries and we find lymph nodes and lymph vessels. Now see if you can recall superficial fascia and its contents from the images I have shown. Fat, platysma, cutaneous nerves, cutaneous veins, external jugular, subclavian, draining into subclavian, cutaneous arteries and lymph nodes. So this is how images will help you to remember. If you remove superficial fascia, you come to a glistening membrane enclosing your neck, the deep cervical fascia, which, as you can see, is pierced by our favorite 4 nerves. I think by now you're quite fed up of them: lesser occipital, greater auricular, transverse cervical, supraclavicular, the same thing. And also pierced by external jugular vein, like I told you, as it goes down to drain into the subclavian. So now tell me, the roof of posterior triangle is formed by 3 structures: skin, reflected, superficial fascia and its contents, deep fascia. So these 3 structures are forming the roof. Which layer of deep fascia? Investing layer of deep cervical fascia. So roof is done. You remember I told you we are creating a box. The box has 3 boundaries and a roof. What about the floor? Let's go to the floor of posterior triangle. Okay. So come back to the screen now, everyone. You can see a series of muscles here, right? The one on the top has got 2 vertical lines on it. Can you see that? So this vertical lines is of a muscle called semispinalis capitis that has vertical orientation. Below that you can see a series of muscles all obliquely oriented. Okay. So let's begin to understand them. Second muscle, splenius capitis. Third muscle, levator scapulae. Stop. Why are we stopping, ma'am? Because the next 3 muscles can be together grouped as scalenii. Scalenii, scalenus posterior, scalenus medius and scalenus anterior. All one below the other. In the lower angle, you can see the first rib and you can see the first digitation of serratus anterior. I think you've got it to some extent, but you would get it way better if you drew with me. So let's now, before we go there, all these muscles are covered by a layer of prevertebral fascia. Okay. Now let's go to the initial diagram that you have drawn, where you've drawn the boundaries of posterior triangle. Let's now begin a diagram. Okay. So, but we're not going to start it all over again, students. You've already got the boundaries in one diagram, right? Let's just add the muscles of the floor to the same diagram. Remember, for every muscle drawn, it is advisable that you draw the direction of the muscle. Let's draw the diagram then. Here on the top is your semispinalis capitis with vertical fibers. Here next to it is your splenius capitis. Below that is your levator scapulae. Below that, 3 series of scalenus posterior, medius, anterior. Let's draw that. So this is your scalenus posterior. But before you draw the other 2, it's important that you draw the first rib here. Now attach your scalenus medius and your scalenus anterior to your first rib. Okay. Ensure that for every muscle you draw the direction of fibers. Attached below to the first rib, draw your first digitation of serratus anterior. So now you will be surprised how well you are able to tell all the muscles one below the other. Okay. Right from the top, tell me semispinalis capitis, splenius capitis, levator scapulae, scalenus posterior, scalenus medius, scalenus anterior, first rib and first digitation of serratus anterior. So all this is covered by which fascia? Yes, it's covered by the prevertebral fascia. Alright, then let's go back to our PowerPoint presentation. Understand that you have understood quite a bit. You have progressed in your knowledge of posterior triangle. Right. So let's now move on to last part of the posterior triangle boundaries. Then we'll be talking about the contents. Within the posterior triangle, there is one muscle that we've not talked about. Which one is that? Take a look. You can see that there is a muscle which is dividing this triangle. This muscle is called as the inferior belly of omohyoid muscle, which divides the triangle into an upper occipital triangle and a lower supraclavicular triangle. Can you see that the occipital is a larger triangle? The supraclavicular is a smaller triangle. Okay, so now what have we covered? Before we go on to the rest, let's just quickly see if we know what we're doing. Boundaries, done. Roof, 1, 2, 3. Skin, superficial, fascia, deep fascia. Floor, a lot of muscles covered by prevertebral fascia. Right? Then we saw a single muscle dividing the triangle into two triangles. A larger triangle above and a smaller triangle below. Larger triangle, occipital. Lower triangle, supraclavicular triangle. Okay. So now what is our job? Our job is to do each of these triangles, boundaries, floor, contents. Right? So let's go to supraclavicular triangle. Before that, I want you to think. Do you know something about supraclavicular triangle? Yes, you do. Always remember, when you're looking at a topic, think about what do I know, and then you add knowledge to it. If you know something and you don't pay attention to that fact, you'll end up studying the same things again and again, kind of depressing you. Okay? So let's take a look at this image. You've drawn it, right? And tell me the boundaries of the supraclavicular triangle. Anteriorly bound by sternocleidomastoid. Now you know the rest. Inferiorly bound by clavicle. Superiorly bound by the inferior belly of omohyoid. You knew this. Okay. Similarly, you know the floor also. This one, which muscle? Scalenus medius. This one, scalenus anterior. This one is the first rib. And this one is the first digitation of serratus anterior. Easy. You already knew these two facts. What is it that you don't know? You don't know the contents. And the contents are very important. This is where the challenge of the class comes in. Rest of it is easy. I'm sure you know that. But this is where the challenge comes in, and this is where you need to have a method of remembering. So now students, concentrate. I'm going to teach you a beautiful method of remembering this. Come on. Okay. Let's take a look at what's happening here. Can you see the cervical vertebrae, first rib and the sternum? And can you see a muscle attached to them? This muscle is scalenus medius muscle. Forming what of posterior triangle? Yes, forming the floor of posterior triangle. Now, the rest of the contents are going to come one in front of the other. Okay? Lying in front of this is a big plexus. Which plexus is that, students? Yes, it's the brachial plexus and its branches, right? In front of that lies your favorite artery. On the left side, branch of aorta. On the right side, branch of brachiocephalic. Of course, it's the subclavian artery. Okay. In front of it, you can see a muscle crossed by a nerve. The muscle is scalenus anterior and crossing it is a phrenic nerve. In front of that, you can see subclavian vein. Okay. And above it, you can see some lymph nodes crossed by the clavicle. So you saw that structures were appearing one in front of the other. Okay. From posterior to anterior, they were scalenus medius, brachial plexus, subclavian artery, scalenus anterior, subclavian vein, supraclavicular lymph nodes and clavicle. Yeah, but if I begin to ask you details, would you be able to tell me? Not likely, because there is too much happening, right? So what we're going to do is we're going to group the contents into, so that's your triangle. That's your inferior belly of omohyoid. And this is where your contents are, packed in that tiny little supraclavicular triangle. So we are going to group the contents into nerves, arteries, veins and lymph nodes. Maybe that will help you to remember. Let's see how it works. Try to remember by understanding. There's no point in mugging at all. Okay. So here you can see the same cervical vertebrae, the same first rib again, and the same muscle again, which is the scalenus medius. Till here, all of you know what's going on. Correct? Right. In front of this is your scalenus anterior with a gap. Please go to this small little gap and you can see that there's a clear gap between scalenus medius and scalenus anterior. Through the gap, your brachial plexus and subclavian artery are going to emerge. Okay, so let's concentrate on that space. Okay, here is your brachial plexus emerging out. You can see it's giving out a number of branches. Okay, so these are the trunks of the brachial plexus giving rise to branches. Label them. Dorsal scapular nerve. Please say them as I say them. There's no point in my talking and you just listening. Dorsal scapular nerve, suprascapular nerve, nerve to subclavius, and the beautiful nerve that goes to your serratus anterior. Yes, long thoracic nerve of Bell. Now imagine which of these are actually coming in your supraclavicular triangle. Group them together. So summarize, nerves seen in supraclavicular triangle are as follows. Trunks of brachial plexus, long thoracic nerve of Bell, nerve to subclavius, and suprascapular nerve. Why not the dorsal scapula? Because it's going higher and will be seen in which triangle? Occipital triangle. Brilliant. So we are done with the nerve content of supraclavicular triangle. Take it now to the scalenus anterior crossbed phrenic nerve and then observe how the subclavian artery enters into the picture. This subclavian artery, as you can see, is divided into three parts by the scalenus anterior. This is your subclavian artery, this is your scalenus anterior, dividing it into part proximal to scalenus anterior, part behind scalenus anterior, part beyond scalenus anterior. First, second and third part. So in my supraclavicular triangle, I can see the third part of subclavian artery. It's branched the dorsal scapular artery and two more branches. Can you see two branches above? These are branches from first part of subclavian. They are superficial cervical artery and suprascapular artery. Now see if you remember. The arteries in the supraclavicular triangle are as follows. 1. Third part of subclavian. 2. Superficial cervical, suprascapular and dorsal scapular arteries. Dorsal scapular being part of branch of third part and the upper two being branches of first part. Okay. Let's take it forward from here. I can see my subclavian. Try to remember what drains into subclavian. I taught you right in the beginning of this class, external jugular. Good. And what you also see here is the supraclavicular lymph nodes. Okay. So now let's put it all on screen. Veins, subclavian and terminal part of the external jugular. Lymph nodes, supraclavicular lymph nodes. Right. So now I think there is some chance of your remembering the contents. The contents of supraclavicular triangle can be grouped into nerves, arteries, veins and lymph nodes. The nerves are trunks of brachial plexus, the long thoracic nerve, nerve to subclavius, suprascapular nerve. Please observe I have written phrenic nerve here. Sometimes if you really dissect well, you might land up exposing the phrenic nerve which is crossing the scalenus anterior from across. Arteries you already know are third part of subclavian artery, superficial cervical, suprascapular, dorsal scapular arteries. Veins are subclavian and the external jugular draining into it. Lymph nodes are supraclavicular lymph nodes. So, if you try and understand and if you try to group together your answers, you will be surprised at how fantastically you are able to recall all the contents. Since this is a very commonly asked question, you need to remember these things. Alright, I am hoping that I have helped you to understand this and memorize it in an easier way. Let's go to occipital triangle. Right, you must be thinking, my God, this one's a bigger triangle. How many contents is she going to tell us? No, the nice part is that though the triangle is big, the contents are small. Okay, so we are in the home run now. Hang in there. Okay, So occipital triangle, again, what do I know? I know the boundaries. I know the floor. I know you also know it. Anteriorly bound by sternocleidomastoid, inferiorly by inferior belly-of-femohyoid, posteriorly the trapezius muscle. You know it. The floor is formed from above downwards by semispinalis capitis, splenius capitis, ligatus scapulae, and scalenus posterior. You know it. Covered by, yes, prevertebral fascia. Right. So we come back to the same question, what are the contents? By now you know how I'm doing this. I'm going to group it together into arteries, nerves and lymph nodes. I won't talk about veins because there aren't too many here worth remembering. So let's talk about the arteries first. Can you see that's the inferior belly-of-femohyoid, by the way. So here you can see the tortuous occipital artery branch of external carotid artery. And here you are seeing the superficial cervical artery. We've already seen a branch of first part of subclavian. Arteries done. Let's come to the nerves. Now here I want you to concentrate. Okay. What we see running across on the levator scapulae is a beautiful thick spinal accessory nerve. Now this is very important because this nerve actually is not covered by prevertebral fascia. It lies flush with the deep cervical fascia, which is the roof. So the moment you take an incision to enter into posterior triangle, unless you are careful, you are going to cut the spinal accessory nerve. So this relation is very, very important. All the other structures, almost all of them, are covered by prevertebral fascia. Only the spinal accessory nerve passes through the triangle flush with the roof, which is the investing layer of deep cervical fascia. It is accompanied by two nerves, C3 and C4. All three of them go towards the trapezius, supplying it. Now we also see our four common favorite nerves. Which are they? Lesser occipital, yes. Behind the ear, angle of mandible, greater auricular, transverse cervical, and the supraclavicular. So I don't think by now I need to teach you all this. Just you remember one, you will remember the rest. Right. We also see the upper trunk of brachial plexus and the dorsal scapular nerve. Finally, what are the lymph nodes I see? One high up in the occipital region, occipital lymph nodes, and one which is along the spinal accessory, which are the lymph nodes which we try to drain, and we are likely to again damage the spinal accessory nerve. So let's see if you remember the contents, dear students. This time you remember we're going to group them together. Which arteries? Occipital artery, superficial cervical artery. Which nerves? Which is the nerve you're supposed to remember? Spinal accessory. What accompanies it? Third and fourth cranial nerves. What are the four cutaneous nerves? 1, 2, 3, 4. You already know that. And finally, dorsal scapular nerve and upper trunk of brachial plexus. Which lymph nodes? Occipital lymph nodes and lymph nodes along the spinal accessory nerve. It depends upon how comfortable you are in grouping them together. If you seek to mug up, then it's a different matter. For me, knowledge is about using logic. So if you use logic, then it's likely that you will remember 100% of the contents of occipital triangle. Now what I feel that I believe you need to draw the occipital triangle. I'm going to quickly take you through it. Okay? Try and practice this. This way you will remember the contents even better. Okay? So let's quickly start another diagram, students. Right. So here you are seeing the three boundaries. Anteriorly formed by sternocleidomastoid, inferiorly formed by inferior belly-of-femohyoid, posteriorly formed by the trapezius. In the posterior wall, I can see my semispinalis capitis, splenius capitis, ligatus scapulae, and the scalenus posterior. What are the contents I see? Let's talk about the arteries first. Okay, so I can see a beautiful tortuous artery passing upwards. That's my occipital artery. I can see a very slim and narrow superficial cervical artery crossing it from inferiorly to posteriorly. Now let's come to the nerves. Now what is the nerve I must always remember? I must remember the spinal accessory. So the spinal accessory crosses on the levator scapulae from the sternocleidomastoid to the trapezius. Question, who accompanies it? C3 and C4 nerves. Okay, so draw those. Who hooks the spinal accessory to go up to the occipital region? Lesser occipital. Who goes to the ear and angle of mandible? Greater auricular. Who crosses the sternocleidomastoid and supplies the anterior part of the neck? Transverse cervical. And who goes towards the clavicle dividing into three? Supraclavicular. What you also see is the dorsal scapular nerve and upper trunk of brachial plexus. Okay, so draw those. Finally, the last two lymph nodes, a couple of lymph nodes lying in the occipital region and couple of lymph nodes lying along the spinal accessory nerve. Okay, that completes an extremely simple diagram. But looking at the diagram, you're likely to never forget even one content of the occipital triangle. Okay, so having completed the boundaries, contents of the posterior triangle, after dividing the posterior triangle into a larger occipital triangle and a smaller supraclavicular triangle, so what is the applied importance? Sometimes your patient can come with an enlarged supraclavicular lymph node. Chances of it being tuberculous matting or malignancy have to be considered. Let's talk about specifically the supraclavicular lymph nodes on the left side. When these are hardened, okay, they are called as Furcow's lymph nodes. What are they called? Furcow's lymph nodes. And they are indicative of testicular cancer, stomach cancer, or sometimes cancer of some other abdominal organ. Okay. Now, suppose you have an injury to the upper limb with massive bleeding. What are you going to do? Last minute. You're going to just put your finger down here and compress your subclavian against the first rib. That's an amazing relationship. You remember your subclavian is crossing it, the first rib across to continue as the axillary artery. Just hit it there. Stop the bleeding. Okay. Infection of the axillary sheath, I have explained to you earlier how infection from the prevertebral fascia region can transcend down, tracking along the axillary sheath and can show symptoms in the upper limb. Brachial plexus is right here, students. An injection in this region can block off your brachial plexus, making any maneuver in the upper limb quite easy, which is what is done in regional anesthesia nowadays. Brachial plexus is also right here and therefore gets injured quite easily. So if you recall, there is something called as an Erb's point. I'll be elaborating on this in my subsequent lecture in the posterior triangle itself. The compression of Erb's point results in what is called as Erb's-Duchen's palsy. And of course, injury to other parts of brachial plexus results in what is called as the Klumpke's palsy. Okay, students interested should already read up on this or else attend the lecture I'll be putting up on these two very soon. Right. So these are the commonly asked questions on posterior triangle. Okay. I think by now, in a question that is for 10 marks, you will be easily able to attempt about and get 8 marks on this. But for the last 2 marks, you really need to study or else attend the next 2 lectures on the same topic, which will help you to understand the topic a little further in detail, which is definitely required. Okay. We go back to our first MCQ, students. Following structure lies between the investing layer of deep cervical fascia and prevertebral fascia. Remember prevertebral fascia floor, investing layer of deep cervical fascia roof. What lies in between the two? Spinal accessory nerve could be. Splenius capitis is covered by prevertebral. So that's out of the picture. Brachial plexus covered by prevertebral fascia. Subclavian artery covered by prevertebral fascia. Now you are able to give me your answer. Yes, it's the spinal accessory nerve. This is how knowledge of a topic helps you to confidently solve MCQs. Okay. These are some more MCQ, students, which I expect you to spend time solving. I'm of course available for any doubts. You can put up some of your doubts in the comment section. I'll be happy to solve those immediately. Finally, the best way, my dear students, to predict your own future is to create it. By having a good knowledge of the subject, you are actually creating your future. By having a shoddy knowledge of the topic, you are destroying it. What to do is finally completely in your hands. As usual, I enjoyed the class. I hope you did too. Thank you so much. See you across the screen in my next lecture.